Well, I'm glad to be joined now by our panel of Big Ten mental health cabinet members, experts in this field. A lot to talk about. Let's start with this first topic. The creative counseling. I want to start with Randy Ballard from Illinois, Associate AD, Sports Medicine, Director of Integrated Performance. What are the different ways that you're seeing therapy taken beyond the traditional conversations? And maybe, Randy, we start by comparing what a traditional conversation is.
Yeah, I think we've all learned during COVID, there really isn't much of anything that's traditional anymore. I think in terms of the services we provide our student athletes, we've all found that we've had to provide a gamut of resources, not just during COVID, but over the last 5 to 10 years, the landscape of college athletics has changed and evolved. And so providers from sports psychologists to psychiatrists to licensed clinical social workers, equipping coaches and athletic trainers to have meaningful and in-depth conversations, as well as know the resources on their campuses, has been hugely important. Via COVID and even before, I think we had to be creative about being understanding of the demands and the needs of our student athletes. With sending everybody home, we had a big shift in telemedicine. But even before then, figuring out ways, even if it was 20 or 30 minutes in a student athlete's schedule in between class, that if they had a need, they could connect with someone and we could help support them was really important. And so taking a clinical setting of an hour block time slot for a specific therapist and figuring out how to work that into a student athlete's schedule, I think was something that we all realized we had to adjust and focus and understand.
And then especially with COVID, you mentioned the transition to telehealth, and we're trying to find other creative solutions. I know across the Big Ten, we're all kind of operating at different levels in terms of telehealth in person. One of the things we've started doing is walking sessions with our clients just to have that interpersonal connection and get outdoors, some vitamin D. And I think the other big thing that I've seen a lot of this year is, and in the past, but really a big push this year is the use of social media and apps to help enhance mental wellness as well. One of the things with the Big Ten Mental Health and Wellness Cabinet that we've been able to provide across the conference is the call map. And I use that as an adjunct to therapy all of the time with the student athletes I work with. And so not just as an adjunct to therapy, but even potentially as prevention, developing some effective coping mechanisms and strategies that our student athletes and staff can implement into their lives.
Increasing our number of providers and being able to get our counselors, our therapists out to practice sessions, out to games, out to workouts, and just increasing the visibility and the incorporation and integration of them into a true medical model where our athletes can really see them as part of the team. And it really helps, I think, break down the barrier of stigma and allows it to be kind of a more normal interaction. It normalizes, in a sense, mental wellness instead of just seeking mental health care for a particular issue. So, that's something that is really proud of for me personally to be part of this group because I've seen the focus on that even before we had the pandemic, which of course threw everything upside down. But, our group is really dedicated to that kind of ideal.
It really changes the dynamic of how they see mental health. Do they see it on that continuum of care from, maybe psychological struggle to thriving? And how do we meet them at every stage of that continuum of care within the familiar environments that they're in? And a lot of times we think at Nebraska about touch points. And for competitive environments, the rate of change that's expected is much higher. And in order to achieve that rate of change, you have to connect with the athlete more frequently. Think about it as dosage, right? You have to increase the dosage of treatment. And to do that, we have to be interfacing with them in their team environment, at their practice, in individual sessions, maybe in the privacy of an office or a walking therapy. But you have to get all of those touch points. And if you can accumulate more touch points through those different modalities, you increase the rate of change that's expected within a competitive environment.
What we've seen is that as high performance services, mental health services have started to become not just accepted, but actually encouraged, we've really had to widen the range of interventions that we provide for our student athletes, whether that's what we're doing, how we're doing it, and where we're doing it. So really, again, like Brett, you were saying, being out at practice. Sometimes it is, like Michelle said, taking a walk. A lot of our student athletes, understanding the limitations of confidentiality, have also said, let's go for coffee or let's meet here. There's no shame in being seen with one of the sports psychologists or one of the psychotherapists. It's actually this opportunity to say, hey, I'm taking care of myself, like, come with me, or like join the conversation. And it's been great to see how research is also supporting that translatable skills happen in environments that people feel more confident and more comfortable in. So we're producing better outcomes when student athletes are creating that space, that safe space with us, that make it all possible. So it's been an honor to see the translation over time.
Pretty interesting look at how things are a little different now, whether it's not the standard hour meeting or not even being in person, telemedicine, or being in person, but walking. All are ways that have been able to benefit people. This has been an interesting look. My thanks to everyone here on our Big Ten Mental Health Cabinet members.